you.
I'll just get you more water just in case.
Thank you. tell you the plan?
Not yet.
Oh, it looks like we're good to go. That
Yeah,
every
they're asking me the pharmacy.
yeah, yeah. You just to be clear, you were on insulin before coming in, right?
Yeah.
Yeah, yeah. Because we were trying to find it, but I couldn't find the dose. But that's fine. I mean, the important thing is that it wasn't like a new insulin started in the hospital, which means we'd have to show
No, I
you how to
have
use the
already
needle.
insulin before.
Yeah, that's what I figured. Okay. Yeah, so we talked to the infectious disease doctors. They agreed. It's fine for you to go home. That's perfectly safe. They were actually thinking that you don't need any antibiotics, which is great. So we'll just have to watch. And if you have any fevers, you just call and we can sort of come up with a plan. And then we'll get you an appointment next week for sure into the clinic. And then also you need to watch that arm and likely just plan on you probably needing a drain of the fluid. And then your kidney numbers, they're bouncing around. It went up and very, very slightly. Basically, it's the same as it was 2 days ago. And so I think that's because you're not quite ready for the fluid pills. So we'll just plan for a sort of drain within about a week of you leaving. Any questions about all that?
No.
No. Okay. Something I wanted to talk to you about, and it's a lot of papers. Maybe I'll go through it quickly, and then I'll just sort of like leave it with you. Maybe. But basically, I mean, as you know, as like an academic center, we do like research and study how our patients do, and then that helps guide the care of patients in the future. And so there was one that they asked me to talk to you about to see if you would be interested or willing to participate. It's always completely up to you, and we manage you the same regardless of whether or not you agree to be a part of this sort of study. And so, just very quickly, basically, it's the study is called Biobank, and essentially, it's looking at like every piece of tissue that gets taken from a transplant patient, and then they look for trends. So they look at, for instance, the sort of markers in the tissue that they see in patients that did well after transplant versus not well, had rejection, didn't have rejection, and they use that to try to identify like new clues that can tell us earlier even how someone is going to respond. So that's the idea, and basically we have this sort of biobank for all sorts of different transplant samples, like kidney transplants, pancreas, liver, intestinal transplants, and essentially that's about it. They also involve, or I guess, use any stored samples of like blood or urine that you might have had in the hospital for like different reasons. And basically people can be like included in this study if they're more than 18 and they've had a transplant, so you obviously fit. And then there's nothing really that excludes people other than if they don't want to be a part of it for whatever reason. And so if you give permission, then it doesn't necessarily mean that you're like part of the study right away. But if you choose to give me permission, then all it means is I pass your information along to the study coordinator.
Sure.
And so you're not, none of your information is going, none of your tissue is going anywhere, but all it means is that they're allowed to contact you where they can explain more detail and answer all your questions. In terms of things to think about, they just list all the specific things that they're looking at in here. But I guess what's important to know is when it comes to like what happens if you give all your information or allow them to sort of like store some of those samples for testing, you can withdraw at any time. And so there's a sort of pretty good protocol where like if you decide for whatever reason you don't want to be part of it, everything gets removed, all your information. The other thing is it's always de-identified, and what I mean by that is like nothing gets attached to your name or anything that could personally identify you. So the way that it's reported is like females reject more than males. So it's those sort of like generalizations that use your information, but you'll be identified by sort of like a code that is in no way attached to your name, your address, anything like that. In terms of risks, so there's always the risk of like blood draws and that sort of thing, but in general it's just blood draws that you're having done for other reasons, so that's what they're using it for. There's always the confidentiality risk, but they have like 30 pages of information on how they minimize that, and of course we've done a lot of research over the years, so I don't think that's a big concern necessarily. And then there's the like genetic risks. So this they can talk to you more about if you had like questions about it. but people are concerned, I guess, that what if, based on this research study, you're diagnosed with something that you didn't know about your genetics, and then would that impact like your ability to get life insurance or something down the road? And my understanding is there's a law that makes it sort of illegal for insurance companies to discriminate based on your genetic information. However, apparently, if for whatever reason you had a diagnosis as like part of this, then it does not protect you against discrimination by companies that sell life insurance. So I think they can't take it away. They can't discriminate in terms of like your employers and things. But there's always a chance that you were diagnosed with something you didn't know. Now, a lot of people would look at that the other way and say, well, like, I care less about my access to like life insurance or future policies, and I care more about learning about a new diagnosis that I didn't know I had that maybe could have sort of implications for the rest of my life. What do you think about all that?
Good. I go.
Yeah, okay, excellent. So all that means is I'm just gonna pass your, I'm gonna email the study person and say that you gave permission for them to contact you. And then, like I said, nothing gets given away or anything like that. You can think about it further, and then when they call you, you can sort of make a decision with them if you want to participate. Thank you.
Thank you.
All right.
Thank my husband.
Hi,
Hi.
sorry I'm late.
Yeah, no problem. Any questions that we can pass along to her? I think we have a plan for her to go home, so it's just a matter of finalizing the prescription and that sort of thing.
Okay, today?
Yeah, this
Okay,
morning.
excellent.
Yeah.
Okay, cool.
But if anything comes up, you talk to her, you guys have any questions, and we can always come back or be
Yeah.
available, so just let us know. But right now, we're just finalizing the paperwork. They'll come and review that all with you, and then
Yeah,
it
good.
shouldn't be too long before you guys can be on your way.
Yeah, we've done this a lot, many times, so, yeah, we'll be vigilant at home and,
Of course.
you know,
Have a good Thanksgiving, okay?
you too. Thank you.
Thank you.
Hi, I'm back. My name
Oh.
is Dr. Ajit. I'm one of the infectious disease fellows, so
Okay.
we were helping with antibiotics. How are you feeling today?
Feel pretty great.
That's good. So I think, I'm not sure if you explained, your urine culture grew a bacteria. It's usually in our GI tract or our urinary tract, but sometimes it causes urinary tract infections. But your urine analysis that they did that day was negative. That means there's no active inflammation or infection. So you're just colonized with it. So we don't treat colonized unless you get symptoms later in, like, let's say a few weeks later. Like if you get a new urinary symptoms, just go to the doctor or get a new urine analysis. Okay? But otherwise, so the antibiotics you were on for the possible superimposed like skin infection, we checked the level. So you were at goal. You got 3 days of good antibiotics, so that should be good. Okay? Is it okay if I take a picture? I just want to like a beginning and an end picture. So if anything new changes, we have a baseline.
Yeah.
Okay?
Yeah.
I'll put it in your chart. And also, if you notice any changes at home, it's always good to take pictures. So doctors,
I have some pictures
Oh,
of it.
good.
Yeah,
yeah, it's much better.
yeah.
Is it still painful or good? Gone.
No.
I had never seen, I mean, she said that procedure, or, you know, they've gone in the jugular many times. Usually it's just a small little incision that turns into a teeny scar. It's the first time it's ever done that.
Yeah. Sometimes like that area can irritate with these multiple like insults to the skin barrier. But then
Yeah,
the
the
main
more
thing
times you do it, I mean,
the main thing is for us to make sure there's no deep infection. And
Yeah.
and there was a small hematoma, so we just wanted to be safe and cover with any super.
it's a scary spot.
Yeah. But otherwise, and the fevers are likely secondary to the rhinovirus you had. That's the common cold.
Oh, she had the common cold?
Yeah, so
Yeah,
when
my nose.
the runny nose that she had
Yeah.
and the congestion, like that's from the rhinovirus, and that can give you like spikes of fevers too.
So, I wonder where that came from.
Yeah.
Yeah, maybe outside.
Yeah, everyone is coughing, like
I
sneezing
know,
at you.
I
like-
know. I'm wondering if she had it or
And you're always outside in the house. But
when I
but
go to
it's
work,
not-
you mean?
But it's not coughing
What
and
is-
sneezing.
Yeah, I have to leave the house to go to work, babe. And then you know what she does? Makes me go to the grocery store every single day. I say, hey, you know, you're sick. Maybe we could go once every couple of weeks, but no, every day. Hey, get me this. get me that? And I'm like, the more times I go in the grocery store, the higher likely I am to get sick. But I do it for you, and then you break my balls.
Good.
Okay, but it was
Yeah,
nice
sure.
meeting you, taking care of you. Okay.
Thank you.
Take
Yeah,
care
thank
and
you.
have
We'll
a
be-
happy Thanksgiving.
So
Okay?
be-
Now my daughter, she's gonna be happy when she
So
see
what
us.
about this?
So that one was the cultures didn't grow anything so far, and it didn't show any signs of
I
infection
know
from our
no
side.
infection, but is
No.
the ascites going to?
Maybe help me out. Like the added stomach or this one? Which one is it?
Are they going to? Are they planning on having us come back to drain you? Or?
Yes. Yes.
Okay.
We have an appointment. I don't know what day, but
Probably
they're gonna
next
make it.
week.
Yeah, next
They
week.
usually like schedule you for like
Yeah, we're going to the
frequent
clinic.
evacuation.
I'm hoping that the ascites issue will clear up with the stent that they put in. You know, you
It's a
can't
bit
live like
take
this.
time.
Yeah.
Yeah, but
But-
if you have more questions, I can ask Dr. Jordan to like come back. Yeah.
I don't.
Okay.
I was just, hopeful that we were going to be able to treat the ascites with medication, not have to keep draining. But it is what it is. We'll come back.
Take care, guys.
All right, thank you.
Bye.
Okay, ready to go?
All right, well, let's get you dressed. So when you are actually good to go, we can roll out. Oh, is that muted?
No, it's not. No, don't just look at that like that. Just like. Just, he can even see himself. So this is just like.
Well, so now you have a recording of the whole entire conversation, right?
Yeah, she just like.
We can go back and watch that.
Yeah. All the conversation. I don't even notice. I'm just ignore it. I'm just. Yeah, why not?
Yeah, I didn't want to carry all my stuff here, and then, so we'll just go back to the room. You can meet the girl that works at the desk. She's really nice, but that's like every morning I spend a half hour chatting with her about what's going on with you, and she like catches me when I can't escape. She's right there. Very adamant that if you were coming back to the room, that we get a room with 2 beds. I know that Sylvia has told her everything. And she's, wants to make sure I'm not gonna break the rules. I almost thought maybe she was there because of just for me. But it seems like she is there every day. It seems an odd thing to pay somebody to sit there all day. Whatever. So,
Do you need this?
let's take everything. We're gonna have to get an Uber. And then we're gonna have to do some skillful packing. I do have a luggage. I have my luggage container. So at least we can we should be able to fit everything in the luggage. It's like, oh no, the husband's got here. He's gonna ask me a million questions. You need any of this, or is it all going in? I'll leave this for last. So what are you wearing out of here, honey? It's not, I wouldn't say, it's probably gonna be cold for you because it's so hot in here. But it's actually not that bad outside right now.
I'm ready to brush my teeth.
Alright, I'm gonna alert the, I'm gonna let everybody know we're headed home.
I'm gonna brush my brush. I can brush my hair. I'm done. It's okay. I'm gonna wear them first. I come here like early before, like 7 o'clock. Are you ready? So I'm ready. But my husband is coming here 9 o'clock.
So any itching today? Very excited that the itching is gone. It's a very good sign. So what we really want to do is get to the train station before people get out of work. A lot of people are working half days today, so we just want to move along as quickly as possible right now. I have chargers and stuff. I got 2 chargers, so I got enough to charge for your cell phone like 3 times over. Tell me when I can take all that apart. Let's hit the. We're waiting on what? No, we're just waiting for the nurse to bring in the paperwork and go over your meds.
Mm-hmm.
Well, I'm almost thinking we should hit the button now.
Yes.
Tell them that we're leaving. So.
You can remove this after the pictures.
Sandy, things you need to think about, like if you're gonna need something, band-aids, anything like that, if you wanna cover up, you
No, I
know,
want them to cover up.
your face masks, things
I
like
can
that.
get face mask here.
I don't want you to be all nervous because you're gonna be around a lot of people.
I have a face mask today.
I'm just telling you. Alright, I can't do anything until you get dressed. And then I can pack everything. Can we shut that off?
We're not ready yet.
Okay.
Just cover it up after everything is like, where's the paper, where's your bandage? I'm doing it, I'm doing it. So where's my blood? Sure. Where's my phones?
What? What? I didn't hear what you said. Say it again.
Where's my pants?
Your pants?
Yes.
I don't know.
How about it was, how about it, outside?
Huh?
How about outside?
It's not, it's like room temperature.
It's not cold
To
because
you, it might be cold.
I can
To
see that.
me, it's warm.
I can see outside. I know it's disgusting and wet. It looks raining,
Yeah, but it's not freezing cold. It's been cold.
but it's not windy. That's fine to me.
I don't know. We're gonna get an Uber.
Yeah, but I cannot walk.
You have to walk to the Uber. We're gonna have to do this. We're gonna have to walk to get that. Just gonna take our time. That's why the sooner we go, the better off we'll be.
Hi. Can you cover this?
Of course, yeah. Dry dressing.